In the U.S. alone, over 100,000 people over the age of 60 suffer a preventable complication from a common medical screening every single year. Let that sink in for a moment. We've been taught to trust in our annual checkups, to believe that more screening is always better. But what if that belief, that passive trust, is now one of the biggest dangers to our long-term health? What if the most critical health decision you can make isn't about which test to get, but which ones to question? For decades, the standard of care was to simply accept what your doctor recommended. You'd go in, they'd order a battery of tests, and you'd say yes. But the medical landscape has shifted dramatically. New research, new technologies, and a deeper understanding of age-related health have revealed a surprising truth. Some of the very tests designed to keep you safe can, under certain circumstances, put you at greater risk. The biggest danger isn't the test itself, it's the lack of information you have walking into the exam room. We're not here to tell you to skip your doctor, not at all. The goal is to build a new foundation of trust, a trust built on knowledge and partnership. You are the CEO of your own health. The aim of this video is to empower you with the specific information you need to ask the right questions, to understand the risks and benefits, and to become an equal partner in your own healthcare decisions. Before we get into the 4 dangerous checkups, I want you to think back to your last doctor's visit. Did you ever feel a little pressured into a test you didn't fully understand? I'd love to know what that was. Let me know in the comments below. In this video, we're going to pull back the curtain on 4 specific checkups that for many people over 60 are more dangerous than beneficial. By the end of this, you'll have the knowledge you need to advocate for yourself and ensure your healthcare truly serves you. Let's talk about the first checkup on our list, a procedure that has long been considered a standard for men's health, but for many seniors has become a genuine danger. The routine prostate-specific antigen, or PSA, test. For decades, men have been told that a high PSA number is a red flag, a signal to be investigated. But a wave of new medical consensus suggests that for many men over the age of 60, this simple blood test is a blunt instrument that can initiate a dangerous and unnecessary chain reaction with life-altering consequences. The PSA test is designed to measure a protein produced by prostate cells. An elevated level can be a sign of prostate cancer, but here's the critical nuance. It can also be high due to a host of other completely benign conditions, such as a simple urinary tract infection, an enlarged prostate, or even a vigorous workout. For a younger man, catching a fast-growing, aggressive cancer is the goal, and the risk of a false alarm is often worth it. But for a healthy man in his late 70s or 80s, the game changes entirely. This is where the danger begins. A high PSA reading in an older man, who may be perfectly healthy and symptom-free, often triggers the next step in the conventional medical playbook, a biopsy. This procedure involves inserting multiple needles into the prostate to extract tissue samples. It is not without risks. Infections are a serious concern, as are bleeding, pain, and the potential for urinary issues. But even if the biopsy is successful and finds a cancerous cell, the danger is far from over. Prostate cancers are incredibly varied. Some are aggressive and fast-spreading, but the vast majority found in older men are slow-growing, low-grade tumors. These are the cancers that doctors often describe with the term indolent, meaning they are unlikely to ever cause harm or even present symptoms during the man's natural lifespan. Imagine being 80 years old, perfectly healthy, and receiving a diagnosis for a cancer that would never have affected you. Now imagine the cascade of treatments that might follow. This is the true heart of the problem. A cancer diagnosis, regardless of its severity, can understandably cause immense anxiety. This anxiety, combined with the traditional medical approach, can push a man toward aggressive treatments like surgery or radiation. A radical prostatectomy, the surgical removal of the entire prostate, carries significant and well-documented side effects. These include a high risk of urinary incontinence and erectile dysfunction, side effects that can permanently alter a man's quality of life, independence, and personal relationships. Radiation therapy, while non-surgical, also comes with its own set of debilitating side effects, from bowel and urinary problems to fatigue. What we are witnessing is a paradigm shift in medical thinking. The U.S. Preventative Services Task Force, a highly respected independent panel of national experts, now recommends that men over the age of 70 should not be routinely screened for prostate cancer. Their conclusion is based on an exhaustive review of the evidence, which found that for this age group, the potential harms of aggressive treatment for slow-growing cancers far outweigh any potential benefits from early detection. In simpler terms, the treatment is often worse than the disease it's meant to cure. Let me tell you a story that is unfortunately all too common. There was a 78-year-old man, a widower named Lawrence, who was the very picture of health. He was an avid gardener, still drove himself to the market every week, and was a beloved great-grandfather. He went for his routine annual physical, and a new doctor, insisting on a full panel, ordered a PSA test despite Lawrence having no symptoms. The results came back slightly elevated. The doctor, without a detailed discussion of all the options, pushed for a biopsy, and a small, low-grade cancer was found. Lawrence was terrified by the word cancer. He didn't hear the doctor's assurances that it was slow-growing. All he heard was the gravity of the diagnosis. The doctor, following a well-worn path, recommended a prostatectomy to get it all out. Lawrence, feeling pressured and not knowing to ask about other options like active surveillance, agreed. The surgery, while technically successful in removing the tumor, left Lawrence with a life he no longer recognized. The severe urinary incontinence required him to wear adult pads and made his beloved gardening impossible. The damage to his nerves meant he could no longer be intimate, creating a profound sense of loss and isolation. He became withdrawn, lost his spark, and his final years were consumed by the side effects of a treatment for a cancer that, in all likelihood, would never have caused him a day of trouble. This story highlights the danger of relying on a single, imperfect data point, the PSA number, for a critical decision. For many older men, the PSA test is a tripwire, triggering a series of invasive procedures and treatments with risks that are far more immediate and certain than the threat of a slow-growing cancer. It's a prime example of why being a passive patient is no longer the safest course. The goal is to be a partner, armed with this knowledge, ready to ask your doctor, is this test truly necessary for me, given my age and health? And to know that a high number isn't always a direct line to surgery. It's a conversation starter and an opportunity for you to advocate for a path that prioritizes your quality of life above all else. This is why understanding this specific danger is so vital. It's about protecting your health, yes, but it's also about protecting your dignity, your independence, and the very quality of your remaining years.
Now, let's talk about the second checkup that can pose a significant risk to seniors, the overly aggressive colonoscopy. For many, this procedure is the gold standard for preventing colon cancer, and for good reason. But as we age, its role and necessity can change dramatically, transforming it from a routine preventative measure into a high-stakes procedure that may not be necessary for everyone. We've been conditioned to believe that a colonoscopy every 10 years is non-negotiable. But for individuals over a certain age, the risks can begin to outweigh the potential benefits. The danger lies not in the procedure's purpose, but in the procedure itself and the increasingly fragile health of the person undergoing it. The colonoscopy is an invasive procedure that requires sedation and, in some cases, a significant commitment of physical resilience. For a person in their late 70s or 80s, the preparation alone, a liquid diet, and a powerful laxative regimen can be physically taxing, leading to dehydration and electrolyte imbalances. The sedation can also have more serious consequences for older adults, who are more susceptible to adverse reactions, including drops in blood pressure and respiratory complications. But the most critical risk is the potential for procedural complications. The procedure involves inserting a long, flexible tube into the colon to search for polyps, which are small growths that can sometimes turn cancerous. While rare, serious complications like bowel perforation, where the instrument punctures the wall of the colon, or major bleeding can occur. A 2023 study published in JAMA Internal Medicine found that the rate of serious complications from colonoscopies, including bowel perforation, is significantly higher in adults over the age of 80 compared to younger individuals. For someone with a pre-existing heart condition or other health issues, a complication like this could be life-threatening. And this is where we have to be practical. If a doctor finds a slow-growing polyp in a 79-year-old woman with no family history of colon cancer and other existing health conditions, is it truly beneficial to remove it? Or is the risk of the procedure itself and the potential for a hospitalization and a serious complication a greater and more immediate threat? The benefit of finding a small, slow-growing growth may not be worth the risk of a high-stakes procedure for a person of a certain age. Let me share with you a real-world scenario. Consider the case of a 79-year-old woman we'll call Isolde. Isolde was a vibrant and independent woman, a retired school teacher who spent her days volunteering at the local library and tending to her prize-winning rose garden. She had a strong constitution and no family history of colon cancer. But during a routine physical, her doctor, following standard protocol, insisted it was time for her to have another colonoscopy. Isolde was hesitant, as she'd heard about the arduous prep, but she was a person who trusted her doctors implicitly. She went along with it. The preparation was a struggle, leaving her weak and dehydrated. During the procedure, the doctor had trouble navigating a particularly tortuous part of her colon, and in the process caused a minor perforation. Isolde woke up in severe pain, which was initially dismissed as normal cramping. But the pain intensified, and she was rushed to the hospital with internal bleeding. She spent 5 days in the hospital undergoing a more serious procedure to repair the damage. The polyp the doctor found and removed was benign. In a follow-up conversation after her recovery, the doctor was candid, admitting that had he known her colon was structured that way, and given her lack of risk factors, he might have advised against the procedure in the first place. Isolde was left with a significant medical bill, a weakened physical state that made it difficult to return to her garden, and a sense of regret that she had simply said yes. This is the hidden cost of aggressive screening. It's not just about the money, it's about the very real impact on a person's life, independence, and well-being. For older adults, especially those with no family history or symptoms, it is absolutely critical to have a detailed conversation with your doctor about the risk versus the reward. You have to ask about alternative screening methods, such as a stool-based test, which can detect blood in the stool and signal a need for a more targeted investigation, without the risks of an invasive procedure. Now, as you're thinking about this, I want you to consider your own experiences. Have you ever had a medical test that, in hindsight, you felt was unnecessary or that the risks weren't fully explained? Share your experience in the comments below. Your story can help someone else feel they are not alone in questioning the status quo and give them the confidence to be a stronger advocate for their own health. Remember, the goal is not to avoid care, but to seek the right care at the right time.
Let's move on to the third dangerous checkup, one that many people are familiar with but rarely question: overly aggressive cholesterol screening. For decades, the mantra has been lower your cholesterol at all costs. We've been told that a low number is always a good number. But for seniors, this one-size-fits-all approach can lead to a significant decline in their quality of life, all for a benefit that is often marginal at best. The danger here isn't the cholesterol itself, but the aggressive prescription of statins to achieve a cholesterol level suited for someone decades younger, which can have debilitating side effects. The problem starts with a routine blood test. Your doctor measures your cholesterol and sees that your LDL, the so-called bad cholesterol, is a bit higher than the textbook ideal. Immediately, the conversation turns to statins, a class of drugs designed to lower cholesterol. For a 40-year-old with a family history of heart disease, a statin prescription can be a life-saving intervention. But for a healthy 70-year-old with no prior history of heart attacks or strokes, the risk-benefit equation changes completely. A slightly elevated cholesterol level is not the acute threat it once was. The potential benefits of a drastic reduction are often outweighed by the very real and immediate negative impacts of the medication itself. The side effects of statins are well documented, and for many seniors can be life-altering. The most common complaints include severe muscle pain and weakness, fatigue, and even cognitive issues like memory loss and confusion. A review in The Lancet found that a significant portion of older adults on statins report muscle pain and weakness, leading many to stop exercising, a far greater risk to their overall health than slightly elevated cholesterol. This is a critical point. The very drug meant to improve cardiovascular health can cause side effects that discourage the one activity proven to boost heart health and overall longevity: physical activity. Let me share an account that highlights this exact problem. There was a man we'll call Henrik. For 65 years, Henrik had been a model of good health. He was an avid golfer, walking 18 holes 3 times a week, and spent his afternoons meticulously tending to his vegetable garden. At his 65th birthday checkup, his doctor noted a mild increase in his cholesterol levels. Despite Henrik having no history of heart disease, the doctor, following the aggressive guidelines of the time, immediately prescribed a high-dose statin. Initially, Henrik felt fine, and his cholesterol numbers quickly dropped to what his doctor called perfect. But within 6 months, a subtle change began. He started feeling a nagging soreness in his legs and back after a round of golf. The soreness turned into a deep, persistent ache that made walking the course unbearable. He tried to push through it, but the fatigue was overwhelming. He found himself choosing to stay home instead of going to the golf course or the garden. The constant muscle pain and exhaustion stole his passions, his hobbies, and his social life. He felt like a different person, weighed down by a feeling of weakness he had never experienced. His life, once so full and active, had been severely diminished. His cholesterol numbers were ideal, but his quality of life had plummeted. This is the hidden cost of an aggressive, numbers-driven approach. Doctors often focus on the lab results on the page, but they sometimes miss the human cost of achieving those numbers. For many seniors, the goal isn't to live to 100 with pristine lab results. The goal is to live with vitality and independence, to enjoy the activities that make life worth living. A treatment that robs a person of their ability to walk, to play, and to enjoy their life without debilitating pain is a treatment that might be doing more harm than good. This isn't about demonizing statins, which have saved countless lives. It's about a nuanced conversation. It's about asking your doctor, given my age,
my overall health, and my lack of heart disease history, what is the actual benefit of lowering my cholesterol to this specific number? What are the risks? What are the side effects? And what is the likelihood they will impact my daily life? You have to be a proactive patient and advocate for a plan that prioritizes your quality of life, not just your lab numbers. The path to health isn't always about a number on a chart. Sometimes it's about a feeling. The feeling of being able to walk, to play, and to enjoy your life without debilitating pain. If this information about cholesterol and quality of life resonates with you, please hit the like button. And make sure you subscribe to empower yourself with knowledge your doctor might not have time to share. Your support helps us create more content that challenges the status quo and puts your well-being first.
Let's discuss the fourth and final checkup on our list, one that affects millions of women and is often seen as a cornerstone of preventative health: the routine annual mammogram. For many women, this screening is a powerful tool in the fight against breast cancer. But just like the other checkups we've discussed, the benefit-to-risk ratio changes with age. For some women, especially those over 75, a routine mammogram can become a screening that causes more harm than good, a source of profound anxiety and unnecessary medical intervention. The core of the issue is the concept of a false positive. A mammogram is a powerful imaging tool, but it's not perfect. It can detect irregularities in breast tissue that look like cancer, but are in fact benign. For younger women, a false positive might lead to a brief period of worry and a follow-up test. But the overall benefits of catching an aggressive cancer early are generally considered to outweigh this risk. However, for an older woman, this can trigger a dangerous cascade of events. The National Cancer Institute notes that for women between the ages of 70 and 79, mammograms have a false positive rate of up to 50%, often leading to a cascade of follow-up tests and unnecessary stress. Think about what a false positive really means. It means you are called back for more tests, more mammograms, more uncomfortable compressions, and in many cases, a biopsy. A biopsy is an invasive procedure where a doctor uses a needle to remove tissue from the breast. It's painful, can cause bruising, and is emotionally draining. Imagine the days or even weeks you spend waiting for the results, a period of extreme anxiety and fear, all because an image on a screen was ambiguous. For a very elderly woman, the physical stress of the procedure and the immense emotional and psychological toll of a cancer scare can be more damaging to her overall health and well-being than the disease itself. A biopsy can lead to complications, and the stress can impact her cardiovascular health, sleep, and mental state. Even when a cancer is found, the question of treatment is critical. Just like with prostate cancer, some breast cancers are incredibly slow growing. For a woman in her 80s or 90s, a small, indolent tumor may never become life-threatening. Yet the diagnosis often pushes women toward aggressive treatments like a lumpectomy, mastectomy, chemotherapy, or radiation, treatments that carry significant side effects and can drastically reduce a person's quality of life. The very treatment intended to extend life can make the remaining years miserable, robbing her of her energy, her independence, and her dignity. Let me share a story that illustrates this perfectly. An 82-year-old woman we'll call Ilara was living a peaceful, active life. She was a painter, an artist whose hands were rarely still. She went in for a routine mammogram, and the radiologist noted a suspicious area. Ilara was called back for a follow-up mammogram and then a biopsy. The entire process was terrifying. The waiting period for the biopsy results was a nightmare. She couldn't eat, she couldn't sleep, and her hands shook so badly she couldn't paint. The emotional toll was immense.
The physical toll of the biopsy left her with a deep, persistent ache in her breast. Finally, the results came back. No cancer was found. It was a false positive. While she was relieved, the experience had left a permanent mark. She lost confidence in her body, and the fear of the what if lingered. She began to question every ache and pain. The system, in its attempt to protect her, had instead caused her immense and unnecessary suffering. She had endured a traumatic experience for a non-existent threat. This scenario is too common. We've been taught to believe that screening is always a positive act. But for older women, it's essential to have a frank conversation with your doctor about your personal health, your values, and your goals for your remaining years. You have the right to ask questions like, given my age and overall health, what is the likelihood that a mammogram will find a cancer that would actually be life-threatening to me? What are the risks of a false positive? And what is the plan if something is found? This is not a conversation about being a hero or being naive. It's about being an empowered patient. It's about prioritizing your peace of mind and your quality of life. The goal isn't to live forever. It's to live well for as long as possible. And sometimes the most proactive, life-affirming decision you can make is to question a routine that may no longer be serving your best interests. This is about making informed choices that protect not just your physical health, but your emotional and psychological well-being as well.
We've covered a lot of ground today. We started by challenging the old idea that more checkups are always better. We then pulled back the curtain on 4 specific screenings that can pose a danger to seniors. The routine prostate cancer screening, which can lead to unnecessary life-altering treatments. The aggressive colonoscopy, with its increasing risks for those over a certain age. The overly aggressive cholesterol screening, which often prioritizes numbers over quality of life. And the routine annual mammogram, with its high rate of false positives and immense emotional cost. The key takeaway is this: the rules have changed. The goal here isn't to skip your doctor. It's to be a better, more informed patient. It's about walking into that exam room as an equal partner, armed with the knowledge to ask the right questions and make a choice that aligns with your health goals and your values. Your well-being is not just about a lab result. It's about your independence, your vitality, and your peace of mind. Now that you're armed with this knowledge, what's one question you're going to ask your doctor at your next visit? Let us know in the comments below. And if this video empowered you, please share it with a loved one. Your support helps us spread this life-changing information. Because in the end, true health isn't just about adding years to your life, it's about adding life to your years.